Dr. Stecher, one of the things we're hearing a lot is about these being new vaccines, but as we've been trying to educate on the mRNA vaccines, while the technology being used for this specific virus is different, this is something that's been around. Can you help families understand the difference really between the mRNA and the other types of like the Johnson & Johnson COVID vaccine that's out there, which is considered a viral vector vaccine?
Yes. So both the mRNA, which is the Pfizer, the one that would be approved at this point for the 5 to 11, and the viral vector vaccines contain instructions that teach your cells how to create the spike protein that's on the surface of the COVID molecule. So our cells produce those spike proteins to the immune system so that we can develop a good response, so that if you come into contact with the coronavirus out in the community, that your body would be able to remember that and fight it off. So the mRNA vaccine, it's surrounded by tiny lipids that help it get into your cell, but not into the nucleus where your own DNA is just an outside of the cell. So then that can teach your body how to make those antibodies to that. The viral vector is where there's actual DNA from the virus is placed inside of a modified version of another virus that cannot cause any illness. So slightly different, but they both create the same antibody response.
Gotcha. Thank you. Dr. Nanawar, the question that I think most parents have on their mind right now is, should my child get the COVID-19 vaccine? So this is your chance to talk to all of the kiddos in our community and our families.
Absolutely. I'll be more than happy to answer these questions. And we are getting a lot of these questions a lot. and I think the parents are more excited about the 5 to 11 year vaccine. And yes, definitely, because the children should get vaccinated. The more vaccinated adults and the children in our communities, in our schools, and at extracurricular activities, the more likely it is that we will stop the spread of the COVID-19. Vaccination not only protects your family, but will also help keep our schools, our teachers, and our communities safe. So as we know that COVID can cause like a milder infection in the kids, but even the mild infection has high risk of developing MISC, which is multi-inflammatory syndrome, where it affects the multiple organs of the body, including the kidneys, liver, and multi-systems. So I think there have been 5,000 cases reported so far with MISC, and the most common age group is age 9. So definitely the vaccine will prevent the transmission of the infection in the community, as well as it will protect you against this deadly virus. So definitely your kids should get the vaccine.